Good day, everyone. My name is Angel Gador. Today, I will present the health promotional plan developed about tobacco use in adolescents, which will help improve their lifestyles and health conditions. A formal presentation outlining a strategic action plan to improve health and prevent disease in a certain population or community is known as a health promotional plan presentation. This presentation will include information on the intended audience, the health issues to be addressed, the plan's aims and objectives, and the strategies and techniques that will be used to achieve these goals. The use of tobacco by teenagers in the United States has long been a serious problem and a public health issue. Approximately 11.5% of American adults were predicted to be smokers in 2021. According to CDC 2019, more than 480,000 Americans lose their lives to smoking cigarettes each year. In 2018, smoking cost the U.S. economy more than $600 billion, including roughly $372 billion in lost productivity and more than $240 billion in healthcare costs. While smoking rates have decreased worldwide over the last several decades, young people increasingly use alternate tobacco products like e-cigarettes or vaping equipments. Various risk factors include peer pressure, familial influence, marketing and media exposure, accessibility of tobacco products, ignorance of health risks, mental health difficulties, and socioeconomic considerations all impact teen tobacco use in the United States. Comprehensive tobacco control measures, awareness campaigns, and limitations on marketing and sales to minors are essential to address this public health issue. According to Mora et al. 2022, cooperation between parents, schools, healthcare providers, and lawmakers is crucial to prevent tobacco use, offering correct information and supporting quitting attempts. Specific identified health needs and goals of the plan. This health promotion program's goal is to encourage adolescents in the U.S. to lead a healthy lifestyle and to live in general good health, with a particular emphasis on avoiding tobacco and e-cigarette use and treating its risk factors. A health promotional plan needs some goals to eliminate tobacco usage among adolescents in the USA. These goals should be SMART to achieve better outcomes. SMART goals, specified, measurable, attainable, relevant, and time-bound, serve as a framework for creating and carrying out health promotional strategies to lower adolescents' tobacco use. Nurses are crucial in communicating SMART goals to reduce teenage tobacco use. Nursing staff members must inform patients and their families about the dangers of tobacco smoking and the advantages of quitting. Nurses may utilize their knowledge and skills to create and convey SMART objectives to assist teenagers in effectively quitting tobacco use. Adolescents can collaborate with nurses to create SMART objectives for their needs and circumstances. The role of nurses is indispensable in providing effective guidance and education to patients to improve their outcomes. This health promotional plan is based on the fulfillment of the following three goals: reduction of tobacco usage in high school adolescent, promote tobacco risk awareness via social media platforms, and promote resources for tobacco cessation. Reduction of tobacco usage in high school adolescents. The first goal of this educational plan is to eliminate tobacco usage, specifically e-cigarettes, in school-going teenagers. A baseline survey might be conducted in high schools to determine the current prevalence of teen tobacco use. Students will then get confidential questionnaires to gather data on their smoking habits. This baseline survey would assess reducing tobacco usage in high schools by 50% within a year. To achieve these goals, collaboration with a school administrator will be performed. They would assist in the implementation of the evidence-based tobacco program. The main purpose is to promote a healthy lifestyle by eliminating tobacco usage in school-going adolescents. This program consisting evidence-based strategies within the next 6 months of the next academic year. Promote tobacco risk awareness via social media platforms. The second SMART goal is to raise awareness of the risks of tobacco smoking among teenagers through a focused social media campaign, measuring engagement indicators such as reach, likes, shares, comments, and website visits to evaluate the campaign's impact. Within 6 months, this goal seeks to grow website traffic by 30% and social media followers by 50%, making it measurable. To do this, there will be a collaboration with marketing experts, health specialists, and youth-oriented influencers. This collaboration assists in creating engaging and educational social media content by optimizing the use of platforms like TikTok, YouTube, and Instagram to reach the target audience. The anti-tobacco campaign in social media will be done within 3 months. Number 3, promote resources for tobacco cessation. The third goal of SMART is to improve adolescents' support and resources for making smoking cessation through collaborations with community groups and healthcare practitioners. The goal is to create relationships with at least 3 local healthcare organizations and 2 community groups within 6 months and see a 25% increase in youth use of tobacco cessation programs within a year. This goal can be achieved by collaborating with healthcare professionals and organizations, developing the cessation program, and providing training and resource material. It would help them to counsel the tobacco-addicted individual effectively. According to Siddiqui et al. 2022, 6 months have been set to develop the cessation program, including collaborating with healthcare professionals and organizations specialists in treating tobacco-addicted individuals. Educational outcomes and the attainment of agreed-upon health goals. Evaluation of the presentation depends on knowing the goals of this educational session to help community members improve health outcomes. Tobacco usage in the USA is a major cause of mortality in the United States, and its educational program must be implemented to spread public knowledge of tobacco-associated risks. It is never too late to eliminate tobacco usage, and an effective educational program can help realize this for the addicted user. It is essential to regularly assess how well the comprehensive tobacco prevention programs implemented in high schools are functioning. All aspects of the program should be assessed, including its reach and participation and engagement rates. For this, feedback can be collected from the students, instructors, and administrators to gauge their satisfaction with the program implementation. Another way to evaluate the outcomes of the goals is to analyze the impact of the students' access to educational materials. Students' learning process is assessed through pre- and post-test or knowledge assessments. The evaluation's findings will demonstrate how well the material convey information about the risks associated with smoking. The best way to monitor the success level of the social media campaign. Keep track of website visits, reach, likes, shares, and comments as engagement metrics for the intended social media campaign. Also, compare the metrics' performance with the set objectives. It would help analyze how well the campaign drew attention to the dangers of young tobacco use. To evaluate the promotion of tobacco cessation resources, keep track of the number of adolescents who seek help from resources and services to quit. Monitor the number of teens who attend support groups, counseling sessions, and stop smoking programs. Furthermore, it is also necessary to collect participant feedback on the success of the instructional sessions and materials, including that of students, instructors, and healthcare professionals. It would help pinpoint areas that need work, then adapt as appropriate and enhance the program. Overall, the following outcomes are accepted from this health promotional plan. Reduction in tobacco usage in school teenagers by 50%, create awareness about tobacco hazards through social media campaigns. The target is to gain 50% social media follower attention and 30% website traffic. Enhance the tobacco cessation resource availability by 25% for the tobacco-addicted adolescent. The need for revision in the educational plan depends upon the outcomes of the goals. The revision's goal is to improve the outcomes of the next promotional plan. For instance, the social media campaign regarding tobacco cessation fails to meet the set target. There could be a need to alter the campaign content or the targeted social media platforms. Furthermore, if it were discovered that adolescent support partnerships and tobacco cessation resources did not increase cessation services among adolescents as anticipated, then it would be necessary to modify the outreach strategy or provide more resources and training to healthcare professionals. Healthy People 2030 is a set of national health objectives established to direct public health programs and improve the health of individuals and communities in the United States. It could considerably impact the effectiveness of programs designed to reduce teen smoking. The Healthy People 2030 agenda has multiple objectives that have to do with ending tobacco use. These goals seek to decrease the prevalence of tobacco use, provide access to options for quitting, and encourage smoke-free surroundings. Some of the Healthy People's goals regarding tobacco cessation are given. Reduce the number of teenagers using tobacco products, raise the number of smokers who quit smoking or tobacco consumption, increase the percentage of healthcare professionals who offer tobacco cessation treatments, and increase the percentage of smoke-free workplaces, eateries, and clubs. The Healthy People 2030 agenda proposes methods based on research, including raising tobacco pricing, enacting complete smoke-free regulations, and granting access to help for quitting smoking to meet these goals. This agenda also highlights the significance of tackling health inequities caused by tobacco use, particularly in low-income and marginalized communities. Healthy promotion programs targeting tobacco use may ensure they tackle the most important public health issues and use evidence-based methods to achieve their objectives, connecting with Healthy People 2030 agenda. Healthy People 2030 places significant value on the need for collaboration and partnerships across several stakeholders. Collaborations with local schools, community organizations, and healthcare experts may increase the educational initiative's reach and effectiveness. Developing comprehensive tobacco control measures may be aided through collaboration, stimulating information sharing, and combining resources. Healthy People 2030 prioritizes addressing health disparities and fostering health equality. The design and delivery of the educational sessions may consider the unique needs and challenges faced by underprivileged groups. This approach ensures equitable session results and assists all teenagers in reducing tobacco use, regardless of socioeconomic background or other health-related considerations. If educational session outcomes align with Healthy People 2030's objectives and guiding principles, they may have a higher impact on reducing teen tobacco use. This connection enhances the session's authenticity and effectiveness, helps track advancements toward national health goals, and fosters cooperation in tackling tobacco use as a public health issue. There could be a need for revision to improve tobacco cessation outcomes in the future educational plan. Nurses must use an updated curriculum and research to deliver educational presentations and seminars to community members to align these sessions with the Healthy People 2030 goals. Nurses should also need to educate and equip themselves with the best available resources regarding the consequences of tobacco usage. It would assist them in guiding the patients or the community better and bring more positive outcomes. In addition, nurses must expand their understandings of alternative available treatment. Furthermore, it is also necessary to have a feedback session at the end to provide effective insight for future medications and enhancements in the future educational plan. In conclusion, addressing teenage tobacco use is an important public health concern, and educational programs are essential to attempt to prevent and stop smoking. These educational programs may significantly reduce teen tobacco use by using SMART targets and complying with ideas of Healthy People 2030. The sessions aim to give teenagers a healthier environment and the power to make informed decisions about tobacco use through comprehensive tobacco prevention programs in high schools, collaboration with stakeholders, and providing educational resources, counseling services, and support groups. The Focus social media campaign uses well-known channels to reach a large audience and raise awareness of the risks associated with tobacco smoking. Thank you.